Hello, I'm Marta and today I'm going to talk about the Aarskog syndrome. This syndrome is a genetic disorder that affects most of the parts of the body, but especially the facial features and the hands. It is caused due to a mutation of the FGD1 gene, also known as the faciogenital dysplasia 1 gene. This gene is located in the arm structure of the X chromosome, so that's why it's considered an X-linked inherited disorder. Now on the photo of the right, apart from seeing how genetic disorders are passed from the parents to the child, you can see how it affects in the Aarskog syndrome that those yellow spots are the syndrome located on the arm structure. Some more facts about this syndrome is that it is named after Dagwin Aarskog, a Norwegian pediatricist and human geneticist who first described it in 1970, and for Charles I Scott Jr., an American medical geneticist who described it after Dagwin and improved the studies of this syndrome in 1971. Also, this condition mainly affects males, although females may have it, but it's very weird and won't have the same features as in males. Some of its general symptoms are that people with this syndrome frequently have mild to moderate short stature during childhood, and during puberty they stop growing as the rest of the people with this syndrome. And also, they can have hair defects and different abnormalities in their reproductive organs and its surroundings. Now, to specify a bit more, I'm going to talk about the facial symptoms, and the most common are the widely spaced eyes, a small nose with a long area between the nose and the mouth, and a very marked widow's peak hairline. Then, some of the most common symptoms in the hands are short fingers in general, then curved pinky fingers that, as you can see, they are shorter than usually and bigger, similar to the thumb, and webbing of the skin between some of the fingers. They don't have to be all of them as in this photo, but sometimes their two fingers stick together or three or whatever. And finally, two of the most common symptoms in the mouth are a split in the upper lip that connects the inside of the nose and the mouth, and an opening in the roof of the mouth that is very common in babies with this syndrome. As all genetic diseases, this syndrome can be cured, but there are many treatments that can increase the quality of life of the people with this syndrome, but you can have surgery or orthodontics to correct some of the abnormalities, and also some trials of growth hormone have been effective to treat short stature in this disorder. Finally, these are the websites I've used to get the information for this presentation. I hope you like it and thank you for listening.